Bismillahirrahmanirrahim. My name is Ishtiyaq Hassan. I am from GMM Group 10. Now we will discuss about the topic anti-allergic drugs. Our immune system plays a crucial role in protecting our body against the pathogens. But sometimes there is an exaggerated response. This exaggerated response is triggered by the interaction of the immune system with an antigen and is referred to as hypersensitivity. Hypersensitivity reactions are classified into four types. Type 1 reaction mediated by IgE antibodies allergy. Type 2 cytotoxic reaction mediated by IgG or IgM antibodies. Example of type 2 HS include some form of anemia, blood transfusion reaction, certain platelet disorder, and some type of tissue transplant rejection. Type 3 reaction mediated by immune complexes. Type 3 hypersensitivity is common in systematic lupus erythematous SLE, and the underlies most of the pathophysiology of this chronic autoimmune disease. Type 4 delay reaction mediated by cellular response. Two common examples of delay hypersensitivity that illustrate the various consequences. Type 4 reaction are tuberculosis type and the contact hypersensitivity. Leukocytes. When an allergic reaction occurs, allergen bind the antibodies the body produces called immunoglobulin IgE. Production of IgE is activated by T helpers. Antibodies combat foreign and the potentially harmful substances into the body. Once the allergen bind to the IgE, specific type of cell, including the mast cell, will release the chemical that trigger the symptom of the allergic reaction. Class of anti-allergic drug. Antihistamines. Antihistamines used to treat allergy symptoms fall into two broad categories. Include two broad categories: sedating first generation and non-sedating second generation. The first category include the older antihistamines. These allergy drugs relieve allergy symptom but cause drowsiness and the side effect, including dry mouth. Newer antihistamine are set to non-sedating, although some user may experience drowsiness even from these. Decongestants. These relieve a stuffy nose by the constricting blood vessel, which limit the amount of the secretion coming from the inner lining of the nose. Corticosteroids and leukotrienase receptor antagonists. Antileukin, one of the group of the chemical produced by the body of accompanies inflammation. Leukotrienase are believed to play a major role in causing the symptoms of the asthma. Corticosteroids. Budesonide, Rincourt, Fluticasone, Fructose, Flonase, Mometazone, Trimethylone, and Salidomarin V UNG 0.1% to 30 gram. Cortisol is a major glucotride in a human. It has two primary sections. It stimulates glucogenesis, the breakdown of the protein of the fat, provide metabolism that can convert it to the glucose in the liver, and it activates anti-stress and the anti-inflammatory pathway. It also has weak mineralocorticoid activity. Hypothalamus releasing hormone anti-pituitary. Negative feedback. It is fundamental control of mechanism. Reaching the adequate plasma concentration of cortisol and the corticosterone inhibit the secretion of the adrenocorticotropic hormone ACTH from the adenohypophysis. Allergen immunotherapy, also known as the designation or hyposensitization, is a medical treatment of environmental allergies such as insect bites and asthma. Immunotherapy involves the exposing of people to the large amount of allergen in an attempt to change the immune system response. Allergy medication side effect. Older amphetamine are associated with the drowsiness, dizziness, constipation of the stomach, blurry vision, a dry mouth, nose and throat, and difficulty urinating. The newer the amphetamine are usually well to tolerated, but can be drowsiness, dry mouth, and stomach problem. Nasal corticosteroids can be nasal dryness of irritation, noticeable throat irritation, headache, nausea, vomiting, cough, and fungal infection throat with long-term use. Leukotriene inhibitor are associated with usual weakness, upset stomach, ache, dizziness, cough, headache, trouble sleeping seriously, but unlikely side effect including flu-like symptoms. Nasal decongestant may cause the temporary burning, stinging, or dryness in the nose, and the running nose and the sneezing. Oral decongestant may be cause the dizziness, headache, nervousness, fast heartbeat, increase the blood pressure, loss of appetite, of sleep, and problem. Nasal cholinergics can cause the body to dry nose, nasal congestion of the dry mouth, irritated throat, and taste is mouth, dizziness, and nausea. Topical corticosteroid of skin allergic, burning, itching, redness, and the chair are thinning of skin. This was our topic. Thank you for your attention.